for, again, going back to some of these rare like genetic syndromes that are associated with multiple complex medical challenges. There are usually, there's at least a few kind of clinics or centers of excellence around the country that have been sponsored by these patient advocacy groups. That's also true for, non-genetic things like cerebral palsy or autism. I mean, there are big, good clinics that are multidisciplinary with a team-based approach around the country. And it's a matter of sort of figuring out what center that is in the place that you live and trying to maybe get in to see them once. So you can see the expert team once and then take that information, take that guidance and go back to your local provider, because it's not tenable to see a specialist who lives, who's 5 hours away for all your visits. But I think seeing a center of excellence, usually in a tertiary medical center, once a year, just to find out like what's new, what's on the horizon. Are there new research studies that can be involved in? Are there new treatments? So that's sort of the ideal. I mean, I definitely have patients who organically build their team just based on the needs of their child. So they find a great speech therapist, so they stick with that. And then they find a pediatrician who's used to taking care of kids with complex needs. And that's number two. And that pediatrician, if they've been taking care of a lot of kids with special needs, can help connect the family to other specialists and service providers. I do think having a primary care provider who is used to taking care of kids with complex issues and not just like the well child check is really important, because they can kind of be a good hub for you too.